I'm very happy to welcome you all to the session. Now, I call upon our HOD ma'am, Dr. V. Meena, Head Department of Home Science, Interior Design and Decor, Shikaneka Parameshwari Arts and Science College for Women, to give the introduction about our resource person for today's session. Ma'am,
Yes, thank you, Aisha. Uh, Utmost pleasure, I welcome Dr. Sheba Sangeetha Jeyaraj, Associate Professor, Department of Home Science, and Dean of Academic Affairs, Shift 1, Women's Christian College, Chennai. She has been recognized as the top performing student in both undergraduate and postgraduate programs completed in the Department of Nutrition in WCC College. She received the prestigious Dr. Jubilee S. Pratap Kumar Welfare Association Prize for the best thesis in MPhil Foods and Nutrition. So, formerly served as faculty in the Development Department of Nutrition Dietetics at Jeyaraj College, presented and published research papers at various regional, national, international conferences, and she has been recognized for outstanding paper presentations at international and national conferences and won first place for best paper presentation at the national conference on the Indian Dietetic Association. And ma'am has served as a resource person for numerous national seminars, workshops, and conferences. She chaired a session on atherosclerosis, stroke, and aging at the Elrich II Second World Conference on Magic Bullets held in Nuremberg, Germany in the year 2008. Delivered lectures on the importance of balanced nutrition in various city schools. She actively engaged in organizing Nutrition Week celebrations at WCC College, contributed expertise to Women's Day celebration events emphasizing the importance of diet in the diabetes treatment. Served as an editorial board member for the Nutritional Science Club at WCC College, and she held as an examiner position for various esteemed universities, judged various competitions at interschool and intercollegiate levels, reviewed a textbook on nutrition dietetics, invited as a subject expert for television programs discussing the scope and importance of nutrition dietetics courses, provided expertise for articles in reputable newspapers. She has been invited as a panel member and chief guest for various events and celebrations. She delivered lectures and participated in intervention programs focusing on especially cardiovascular health and lifestyle challenges. She organized workshops and awareness program on nutrition entrepreneurship, millet awareness, and eat right initiatives. She contributed as a subject expert for syllabi revamping in Tamil Nadu State Council for Higher Education (SCRT) syllabus and serving on PhD research advisory committees. Currently, ma'am is guiding PhD research scholars and serving as a dean of academic affairs at WCC College. Thanks a lot for accepting our invitation, ma'am. This session, nutrition dietetics, is the main subject in UGC-NET exam. So this will be really helpful for our students, ma'am. Thanks a lot.
Thank you, Dr. Meena, for that introduction. And first
Yes,
and
ma'am.
foremost, I would like to thank you for inviting me as a resource person for this UGC-NET coaching. And
Yes, ma'am.
at the outset, I would also like to congratulate the department for taking this initiative. And now, I know it's not a very easy task to get resource persons in the field of home science. It's a very
Yes, ma'am.
vast branch and so many subjects, so many
Thank you, ma'am.
specializations. And I think you have done a great job, the department. And I think really we need to congratulate you for taking this initiative for the students. They're doing so much for the students' welfare. And I'm sure the students will be benefited and they'll be grateful to you for this
Yes,
program which you've been organizing for them. And also like nice to see this Kavita there.
ma'am.
Nice to see you also.
Yes.
Okay.
Thank you
So
hello,
so
ma'am.
much, ma'am.
okay.
Yes, ma'am.
Okay. So shall we move?
Participants can switch on the video. We shall have on Snap here. Dear participants, all of you can switch on the video so that we'll have on Snap here. Yes, ma'am. We can proceed, ma'am.
Thank you. Okay, good evening to all of you. So the topic given to me is on nutrition and dietetics. So as I mentioned earlier, it's a very vast area, but I'll try to cover as much as possible in the limited time which is given to me. Okay, so as we know, they're all MCQ questions, but what I have prepared is some objective type questions. So as I go through the questions, I'll also tell you what can be the related questions which can be asked also. So if you can carefully listen to the various subjects, I'll be dealing with physiology, a bit of physiology, then on human nutrition, then clinical nutrition, a bit of dietetics, not too much into detail, but since I know there is another resource person for dietetics, and then also a bit on sports nutrition and food science. So these are the topics which I'll be dealing now. So I think we can go ahead with the PPT presentation. So shall I start the presentation?
Yes, ma'am. Yes, ma'am. Ma'am, I think your volume is a little bit low, ma'am.
Is it low?
Yes, ma'am. Can't able to hear, ma'am. Distractions are coming.
Okay, now am I audible?
Yes, ma'am.
Yes,
It's
ma'am, it's
clear, ma'am.
clear, ma'am.
Clear
Clear
audible.
audible. Okay, then I'll
Yes,
remove
ma'am.
my headphone. I think that is causing problem.
Okay, ma'am.
Okay. Okay. I hope the PPT is visible. The screen is visible to all of you.
Yes, ma'am.
Yes,
It's
ma'am.
visible, ma'am.
Isn't it slideshow? Okay. So I'll just move on to the first subject, which is on physiology. Uh, So I'll just start with a few questions. So I hope all of you have a notebook or a paper to note down as I go through the questions. Okay. So I've just gone through the previous year's net coaching questions. So based on that, I have framed a few questions in various subjects. So these and they have been repeatedly been asked in few papers. So I hope it will be useful for all of you. Okay, so the first question. The structural and functional unit of the kidney is nephrons. I've given the answer also here, so it's easy for you to know the answer. So anyway, they can ask the question. These are all objective questions. So if you know the answer, whatever MCQ they ask, you'll be able to choose the right option. Okay, so in case you want to answer the questions also, you can unmute your mic and answer. So next question I would like to ask is, before going to the second one, what is the structural and functional unit of the living body? If anybody could answer, this is about the kidney. I said nephron. What's the structural and functional unit of the human body?
Ma'am, your slides are not moving.
Not moving?
Yes, ma'am. It's not moving.
1 minute, 1 minute. Now, is it moving now?
No, ma'am.
1 minute. Now is it visible?
Yes, ma'am.
Shall I go
Yes,
this
ma'am.
way?
It's
I think
visible.
this way is better because I put the slide show there is some problem. So is it okay? It's visible now?
Yes, ma'am. It's visible now.
Okay. So the first question, what I said was structural and functional unit of the kidney was the question that the answer is given here as nephron. So the next question I would like to ask all of you is what is the structural and functional unit of the living body? If anybody could answer that, if you know the answer. Okay, it is the cells. You can just note down these questions because I'll be doing alternately side by side other questions also. So you'll know the answers because everything it's not possible for me to fit into the slide. So as and when I give the alternate questions also, you can note down the answers. Okay, the second one, which hormone synthesized by the kidney helps in erythropoiesis? Now, erythropoiesis is known as a formation of RBC. The process of RBC formation is known as erythropoiesis, and there's a hormone which is necessary for the synthesis of RBC, and that is known as erythropoietin. Okay, so this is for RBC. Similarly, for platelets, that is your thrombocytes, platelets are also known as thrombocytes. For the synthesis of thrombocytes, you require a hormone known as thrombopoietin. Okay, just like erythropoietin, you have a hormone called thrombopoietin, which is necessary for the formation of or synthesis of platelets. And platelets are also known as thrombocytes. Okay. Then the next question here is the name the vitamins required for the maturation of RBCs. Okay, so the vitamins which are required mainly for the maturation of RBCs are vitamin B12, which is cyanocobalamin. The other name for vitamin B12 is cyanocobalamin, and vitamin B9, which is folic acid. So these two are the major vitamins which play an important role in the maturation of RBC. The next one, which vitamin deficiency causes pernicious anemia? So this is mainly due to deficiency of vitamin B12. Now, vitamin B12 causes two types of anemia. One is megaloblastic anemia and the other one is pernicious anemia. The question here is on pernicious anemia. Okay, so this pernicious anemia is mainly caused due to lack of intrinsic factor, okay, which is present in the stomach. There is an intrinsic factor, IF factor. It's also known as factor of Castile, Castell. Okay, it's behind the person who actually identified this intrinsic factor. His name is Castile. So it's also known as the intrinsic factor of Castile. Okay, so this intrinsic factor is necessary for the absorption of vitamin B12. Okay, so people who lack this intrinsic factor will develop pernicious anemia because they're not able, their intestine, small intestine, is unable to absorb vitamin B12. So that leads to pernicious anemia. The other type of anemia which can also be caused due to B12 deficiency is megaloblastic anemia. So here what happens, megaloblastic means the RBCs, the size of the RBC is larger. It is bigger in size. That's why we call it megaloblastic RBC. So that again is caused due to deficiency of vitamin B12. And the same megaloblastic anemia can also be caused due to deficiency of folic acid. Okay, so this is the same type of anemia caused due to deficiency of vitamin B12 as well as due to deficiency of folic acid. The next one question, which vitamin deficiency causes megaloblastic is, okay, vitamin B9 and vitamin B12. Sixth one, what helps in the conversion of fibrinogen to fibrin in the blood clotting process? So you have a big cascade in the blood clotting process. So this step is a very crucial step where the fibrinogen, which is a plasma protein, gets converted to fibrin, which is the clot. It forms the clot. Okay, and for that you require thrombin. Okay, for now, for the formation of thrombin, you require something called prothrombin. That is, prothrombin is converted to thrombin first. Okay, with the help of calcium and other clotting factors, this prothrombin is first converted to thrombin. Okay, that thrombin is what is required for the conversion of fibrinogen to fibrin. Okay, so in the blood clotting process. Hope you can see when I'm changing the slide, all of you. Yes, are you able to see the slide, students?
Yes, ma'am.
Yeah.
Yes, ma'am. Yes, ma'am.
Thank you. Thank you. So the seventh one, which blood group is considered as universal donor? So that is blood group O. Now the same way there is a blood group which is also known as universal recipient. That is, they can receive blood from everybody, but they cannot give blood to anybody. They can only receive blood from everyone. That is blood group AB. Okay, whereas blood group O is a universal donor. They can give blood to anybody, but they cannot receive blood from other blood group. Okay, they can only receive from O. So that's why O is known as universal donor and AB is known as universal recipient. Now name the fluid present in the brain. Okay, that is cerebrospinal fluid or the CSF. Cerebrospinal fluid is the fluid which is present in the meninges. That is, the membranes covering the brain are known as the meninges. So this is the fluid which is present in the brain. Similarly, you have various fluids which are present in the body. In the heart also you have certain fluid which is present in the heart. Similarly, you have a fluid present in the stomach, like peritoneal fluid is there in the stomach. In the heart, it is pericardial fluid. Okay, so there are different fluids. Similarly, the joints, you have synovial fluid. So all these acts as a shock absorber for preventing friction. Okay, so that's the main function of all these. They cushion the underlying organs. Okay, so for the brain, it is cerebrospinal fluid. Similarly, for the heart, it is pericardial fluid. For the stomach, peritoneal fluid. Joints, you have synovial, synovial. Okay, so synovial fluid. So these are the various fluids which are present in the body, in the various organs. The next one, how many spinal nerves are present in the human body? So you have 31 pairs of spinal nerves. And the next question is how many cranial nerves? That is 12 pairs. So the put together, this is like we have the peripheral, different type of nervous system. First is the central nervous system, which consists of the brain and spinal cord. Then you have the peripheral nervous system. And mainly this consists of the spinal nerves and the cranial nerves. Then you have one more system, which is the autonomic nervous system, where you have the sympathetic and parasympathetic nerves. So this forms the various type of nervous system in our body. So you have the central nervous system, the peripheral nervous system, and the autonomic nervous system. Next question, where is melatonin produced in the body? This melatonin is mainly produced by the pineal gland. This pineal gland is a very tiny gland which you find near the cerebrum in the brain. It is found in the brain. It's a very tiny gland but plays a very vital role in producing melatonin. If I don't know whether you've heard of this hormone, melatonin is a sleep good hormone. It's mainly produced during night when we sleep. That's why they say you should usually have proper sleep hours, because this main hormone is helps to like a stress buster for you. It relieves stress from the body. So more melatonin is produced, you will have less stress in your body. Okay, so and this is formed only at night. Okay, so in the when you have light in the night, it gets bleached, so it won't be formed. That's why they say you should not stay awake very late in the night, because this melatonin process, synthesis of melatonin, will get affected. Okay, and this is mainly produced by the pineal gland. Then next one, where are Kupffer cells found in the body? Okay, Kupffer cells are mainly found in the liver, and they're known as the macrophages of the hepatic system. Okay, the macrophage, that is, they mainly help in the defense mechanism in the liver. Okay, so those are known as the Kupffer cells and mainly found only in the liver. Then how many lobes are present in the liver? There are 4 lobes which are present in the liver. You have the right lobe, left lobe, quadrate lobe, and the caudate lobe. Okay, so there are 4 lobes in the liver: right, left, caudate, caudate, caudate lobe, and the quadrate, quadrate, and the other quadrate lobe. Okay, and next, what is the normal cardiac output? That is 5 liters per minute. Okay, the normal cardiac, it is 5 liters of blood per minute. Okay, that is the amount of blood pumped by the heart in 1 minute. Okay, that is what is cardiac output, and the right value is 5 liters per minute. And what is known as the pacemaker of the heart? The SA node, as all of you will be knowing as SA node, or the sinoatrial node, is known as the pacemaker or the pace setter of the heart. Now, which is the largest blood vessel in the body? The largest blood vessel is the aorta. And you know, the aorta, the main function of the aorta is to take blood from the left ventricle, pumps the blood through the aorta into the general circulation. Okay, so that's the largest blood vessel, is the aorta in the body. Then, which is the only artery in the body which carries deoxygenated blood? And that is pulmonary artery. The pulmonary artery is the only artery in the body which carries deoxygenated blood from the heart, mainly from the left ventricle. It takes it from, sorry, from the right ventricle. The pulmonary artery, the deoxygenated blood is pushed through the pulmonary artery. It goes to the lungs for purification. Okay, so the pulmonary artery is the only artery which carries impure, deoxygenated means impure blood. Okay, and the only vein which carries oxygenated blood is again pulmonary vein. Okay, that is after the impure blood goes to the lungs for purification. From the lungs, the pure blood is brought into the heart, especially it goes to the left atrium. Okay, the pulmonary veins bring the blood to the left atrium, the pure blood. So usually veins carry impure blood, but this is the only exception is pulmonary vein, which carries oxygenated blood in the body. Then what is also referred to as the heart muscle is myocardium. Myocardium is also known as the heart muscle. Okay. Then how many valves are present in the heart? There are four valves. You have the tricuspid valve, the bicuspid valve, the pulmonary, and the aortic valves. Okay, so on the right side of the heart, you have the tricuspid valve. The left side of the heart, you have the bicuspid valve. The pulmonary valve is at the base of the pulmonary artery. You find the pulmonary valve, and the aortic valve is at the base of the aorta. So these are the four valves, and the pulmonary and aortic valves are also known as semilunar valves. Okay, the pulmonary and aortic valves are also known as semilunar valves because they are half moon shaped. Then which is the master gland of the endocrine system is the pituitary gland. Okay, that is known as the master gland of the endocrine system. Next, name the hormone secreted by the adrenal cortex which regulates water and electrolyte balance is aldosterone. Now, this aldosterone is secreted by the adrenal cortex and is known as a mineralocorticoid. There are three different things which have been synthesized by the adrenal cortex. You have the glucocorticoid, then you have the mineralocorticoid, then you have the sex hormones which are known as androgens. So, this aldosterone is a mineralocorticoid which is secreted by the adrenal cortex. And this hormone plays a very important role in water and electrolyte balance. The next one, name the hormone secreted by the adrenal cortex which helps in stress response, which helps to regulate stress, is cortisol, and this is produced mainly by the adrenal cortex. Again, this is a glucocorticoid. Okay, so this is a glucocorticoid, cortisol. Aldosterone is a mineralocorticoid, both secreted by the adrenal cortex. Then hypersecretion of growth hormone in children leads to a condition called gigantism and acromegaly in adults. So when there's too much secretion of growth hormone, it leads to gigantism in children. That is, they grow very tall. And acromegaly is a condition where the bones become thicker. That is, after a particular age, after adolescence, the bone doesn't grow in length, but it becomes thicker. So that condition is called acromegaly, which you find in adults. Then where is insulin produced in the body? It's mainly by the beta cells of the islets of Langerhans in the pancreas. This islets of Langerhans is found in the pancreas. The beta cells will secrete insulin, which is responsible for reducing the blood sugar level. Okay, the other hormone which was secreted again by the islets of Langerhans is the glucagon. That is by the alpha cells of the islets of Langerhans will secrete glucagon, and that will increase the blood sugar level. Insulin will decrease the blood sugar level. Then where is the hormone calcitonin secreted in the body? Now this calcitonin is secreted by the thyroid gland, and the main function of calcitonin is to decrease the blood calcium level. Okay, there are two hormones which play a very important role in regulating the blood calcium level. One is calcitonin from the thyroid gland, which reduces the blood calcium level. The other hormone is parathormone from the parathyroid gland, which increases the blood calcium level. Okay, that is PTH. It's also known as PTH. Then next one, which gland secretes growth hormone? It is the pituitary, mainly the anterior, because you have anterior and posterior pituitary. Anterior pituitary secretes around 6 hormones. Okay, one is growth hormone. One major hormone is growth hormone, and the posterior pituitary secretes mainly 2 hormones, which is oxytocin and ADH, antidiuretic hormone. These 2 hormones are secreted by the posterior pituitary. The next one, tetraiodothyronin, is also known as thyroxine. Okay, so thyroid gland secretes T3 and T4 hormones. T3 is triiodothyronin. T4 is tetraiodothyronin, or it's also known as thyroxine. Then what causes Cushing syndrome? It is mainly hypersecretion of cortisol. Okay, the glucocortisol is, again, as I told you earlier, it's a glucocorticoid. So Cushing syndrome is mainly caused when there is increased secretion of cortisol in the body. Then what causes Conn syndrome? This is mainly due to excess secretion of aldosterone, again from the adrenal cortex. When there's too much secretion of aldosterone, it leads to Conn syndrome. Which hormone helps to increase blood? This is what I told you. Parathormone, PTH, helps to increase blood calcium level. Now, what does low levels of thyroxine cause in children? So that can cause cretinism. So low levels of thyroid hormone will mainly result in cretinism in children, and mainly in adults it causes myxedema. That's a condition due to reduced levels of thyroxine causes myxedema in adults and cretinism in children. Which hormone helps in regulating water balance in the body? Is mainly antidiuretic hormone from the posterior pituitary. The next question, which hormone is responsible for the let down reflex? Let down reflex is mainly for the release of milk from the mammary gland. Okay, so that's mainly done by oxytocin, again from the posterior pituitary. That's known as the let down reflex. Okay, it's mainly caused by the oxytocin. Which hormone helps in milk production during lactation? It's mainly prolactin. Again, this is a hormone which is secreted by the anterior pituitary. Okay, so prolactin mainly helps in development of the mammary gland and also helps in milk production. But the release of milk is mainly by oxytocin. That's why it's known as let down reflex. The release of milk is mainly by oxytocin, but production and development of mammary gland, the major hormone is prolactin. Then enlargement of thyroid gland is called goiter. Okay, so whenever there's enlargement of thyroid gland, it leads to goiter. The next is, when does ovulation occur? Okay, so in the menstrual cycle, when does ovulation occur? It usually occurs on the 14th day of the menstrual cycle. Okay, so the 14th, totally it's a 28-day cycle. So on the 14th day, you have this ovulation, whereas release of the mature ovum is released. Okay, so that is what we call as ovulation, when the ovum is released. Okay, you have the Graafian follicle, the ovary is there, it releases the mature ovum, which is the Graafian follicle that is released. Okay, the next one, sorry. Which hormone helps to maintain pregnancy? Is progesterone. So there is increased levels of progesterone as soon as the person, the woman conceives. The level of progesterone will increase for 3 months. Then later on, it is taken over by the hormone produced by the developing fetus. But progesterone plays a very important role in maintaining pregnancy. Now, absence of menstrual cycle is called amenorrhea. Okay, so there is lack of menstrual periods is called amenorrhea. Excess bleeding during menstrual cycle is called menorrhagia. Okay, so that's a condition where, the bleeding doesn't stop, it goes continuously, and there can be severe bleeding where there's loss of up to 300 ml of blood also in a day. Generally, it's around 35 to 40 ml which is lost in a day. But here, sometimes 300 or more than 300 ml will get lost. So that condition is called menorrhagia. Then what is known as visual purple? Visual purple is rhodopsin. Okay, rhodopsin is what helps to see in dim light vision. Okay, so that is known as visual purple. The point where the optic nerve leaves the eye is called blind spot. Okay, so this is the blind spot where the optic nerve leaves the eye. This particular spot doesn't have any photoreceptors. You have the cones and rods. Rods help in dim light vision, cones help in bright vision or color vision. So in this blind spot, there are no photoreceptors, no rods, no cones. That's why it's called blind spot. Similarly, you have another spot which is yellow spot. Okay, so yellow spot has more of cone, the bright light, or for the color vision. So that is known as yellow spot. Blind is no photoreceptors at all. Then which cells are responsible for color vision? Is cones. Then what are ear ossicles? Okay, so this comes in the ear. So you have malleus, incus, and stapes. Okay, so this is known as the ear ossicle. So you have the outer ear, you have the middle ear, you have the inner ear. So outer ear is mainly the pinna. In the middle ear, you'll find the ear ossicles. Okay, so inner ear is mainly for balance and hearing. Hearing, it is mainly cochlea. Okay, you have the cochlea as the main organ of hearing. Okay, and for balance, you have the semicircular canals, which are there in the inner ear. Those help in balance. Okay. So, which part of the ear helps in hearing? Is cochlea. Then the outermost layer of the eye is called sclera. Okay, so there are three layers covering the eye. The outermost is the sclera, the middle is the choroid, and the innermost is the retina. So these are the three layers surrounding the eye. So outermost sclera, middle choroid, and the innermost is retina. Now, which part of the brain helps in regulating body temperature? It is the hypothalamus. Okay, hypothalamus plays a very important role in regulating body temperature. The space between the two lungs, okay, is known as mediastinum. Okay, that's where the heart is actually located. It's the space between the two lungs. It's what you call as mediastinum. Then what is the lifespan of RBC? Okay, the RBC lifespan is 120 days, whereas for WBC it is around 12 to 20 days. That's the lifespan of WBC. For platelets it's around 7 days, 7 to 10 days maximum. That's the lifespan of platelets or the thrombocytes. Okay, excess RBC in the body leads to a condition called polycythemia. So that's the condition. Polycythemia is the condition where there is increased levels of RBC. Similarly, if you take WBC, it's known as leukocytosis. Increased WBC in the body is called leukocytosis. Decrease in WBC is called leukopenia. Leukopenia. That's called leukopenia, decrease in WBC. Okay, so whenever there's a decrease in platelets, it's called thrombocytopenia. It's very easy to remember. Thrombocytes is platelets. So when there's decrease in platelets, is thrombocytopenia. Okay, so that's the way, one way you can remember. Okay, so that's about the RBC and WBC. So next is, what is the other name for blood platelets? As I told you, thrombocytes. Okay, so these are the questions which are pertaining to physiology. Okay, so some of the questions which I found, I thought was very important, which repeatedly asked in various places, are these MCQs, the questions, these objective questions. Okay, so there are a whole lot of other questions also, but if you know these, if when you study the structure of suppose ear, eye, just remember the names, the layers, what is blind spot, what is a yellow spot. That is what they will generally ask in MCQ. So if you know that only the names of these is more than essential. Okay. So next we'll just move on to human nutrition. Okay, so the first question, who is considered as the father of nutrition? Okay, it is Antoine Lavoisier. In the world, in the global level, if you ask who is the father of nutrition, it is Antoine Lavoisier. But in India, it is Dr. C. Gopalan. Okay, he was considered as the father of nutrition, Dr. C. Gopalan. Then what are macronutrients? Are carbohydrates, protein, and fats are the macronutrients, and vitamins and minerals are the micronutrients. Okay, 1 gram of carbohydrate and protein will give you 4 kilocalories, whereas 1 gram of fat will give you 9 kilocalories, and 1 gram of alcohol will give you 7 kilocalories. Okay. Give examples of monosaccharides. So you have glucose, fructose, and galactose are the main monosaccharides. Similarly, disaccharides also are there. So you have the sucrose, lactose, and maltose, which are the disaccharides. Okay. Then what is known as invert sugar? It's a mixture of glucose and fructose, mainly obtained by breakdown of sucrose. That we call as invert sugar. So sucrose is broken down by an enzyme called sucrase, okay, into glucose and fructose, and that is known as invert sugar. And what is known as milk sugar is lactose. That's the major sugar found in milk is lactose. Which enzyme initiates starch digestion is mainly ptyalin. It's also known as salivary amylase, okay, which is found in the mouth. It initiates carbohydrate digestion, mainly the starch digestion. Mainly acts only on cooked starch. It converts that into intermediate starch particles, okay, mainly by the effect of ptyalin. That's the enzyme mainly used for initiating starch digestion. Then give examples of branch chain amino acids. It's isoleucine, leucine, and valine. Okay, these are the branch chain amino acids. Which amino acid is deficient in cereals? It's mainly lysine. Okay, lysine is deficient in cereals, and if we take pulses, it is mainly methionine. What is the age of reference man and reference woman? So based on the reference man and woman only, the RDA is actually given. The recommended dietary allowances are given based on the reference man and woman. So for the reference man, it is 65 kg, and for reference woman, it is 55 kg. Give an example of a fibrous protein, collagen. Okay, collagen you find in the bones and teeth, and also as an intercellular substance also is collagen. Okay, so this is an example of a fibrous protein. Where is keratin usually found in the body? Mainly in the skin, hair, and nails, you will find keratin. What is DIAAS? It is digestible indispensable amino acid score. DIAAS. Okay, digestible indispensable amino acid score. So this gives an accurate method of evaluating protein quality. Like indispensable amino acids are the essential amino acids. So this is one method by which you can quantify or evaluate the quality of essential amino acids. Which oil has MCT? MCT is medium chain triglyceride, that is coconut oil. Okay, so medium chain triglyceride, coconut oil has medium chain triglyceride, generally used, given for people who have malabsorption syndrome. Okay, so that can be taken for people with malabsorption because it doesn't require bile for absorption. So that's the reason coconut oil can be given for such those patients. Which fatty acid is present in trans fat? Okay, it's called eleidic acid. That's the fatty acid which is present in trans fat. I'm sure all of you have heard of trans fat. It is more at the more cause of a major risk for heart disease. Trans fat and all these junk foods, all mainly partially hydrogenated vegetable oil. Those are all trans fat, and that kind of acid present is eleidic acid. What is omega 9 fatty acid? Is oleic acid. Okay, oleic acid or your MUFA. That is monounsaturated fatty acid is called omega 9 fatty acid, or it is also known as oleic acid. Then give examples of EFA. EFA is essential fatty acid. So the essential fatty acid is linoleic, linolenic, and arachidonic acid. These three are known as essential fatty acids. So three: linoleic, linolenic, and arachidonic acids. Which is the richest plant source of omega-3 fatty acid? Is flaxseed. Okay, the richest animal sources, fish and fish oils. Okay, they are the richest source of omega-3 fatty acids if you ask for marine source. But for plant source, it is flaxseed. Though it is also present in some amount in soya bean and almonds, all you find omega-3, but the richest source is flaxseed. What is the ratio of omega-6 is to omega-3? Is 5 to 10 is to 1. Okay, so that is the ratio of omega-6 is to omega-3. Then how is the energy value of food determined in direct calorimetry? Is mainly by bomb calorimeter. Okay, so that is how it is by direct and indirect calorimetry methods are there. By direct method, it is bomb calorimeter. What are macro and micronutrients? Now, if daily requirement is more than 100 milligram, it is referred to as a macronutrient. If the daily requirement is less than 100 milligram, it is referred to as a micro mineral. Okay, macro mineral and micro mineral. Okay, macro is more than 100 milligram if it's required. Micro is less than 100 milligram required per day. Okay, so that's the differentiation for macro and micro mineral. And what are the major minerals in the body? Major minerals are calcium, then you have phosphorus, sodium, potassium, chloride, magnesium, and sulfur. So these seven are considered as major minerals. Okay, calcium, phosphorus, sodium, potassium, chloride, magnesium, and sulfur. Okay, the rest are all micro minerals. How is calcium deficiency diagnosed? So this the diagnosis is DEXA or BOFA, that is bone mineral density. Okay, that is one test which is done. Okay, which is dual X-ray absorptiometry. Okay, and the other one is serum calcium level, where you can check the serum calcium level. So it's bone mineral density. Then, what are the effects of calcium deficiency? It leads to osteoporosis is one, and tetany. These are the two forms of calcium deficiency: osteoporosis and tetany. That is weak bones. Being the bones become more brittle, more prone to fracture. That's what we call as osteoporosis. And tetany, where you have imbalance in the hands and all, you find tremors. All that is tetany caused due to calcium deficiency. Name any two vasodilators. Okay, magnesium and potassium are vasodilators, and the functions of vasodilator is to bring down your blood pressure. Okay, so if a person is hypertensive, then generally they'll recommend vasodilators. So one natural vasodilator is magnesium and potassium. So foods or supplements containing that can be given. What is the ideal calcium phosphorus ratio? Is 1 to 2 is to 1. Okay, so 1 to 2, oh, that's the range. 1 to 2 is to 1. That's the ideal calcium phosphorus ratio. Next is, what is hypokalemia and hyponatremia? So the potassium deficiency is called hypokalemia. Sodium deficiency is called hyponatremia. Okay, so you can easily remember by the letter K. K is for potassium. Okay, so if it's deficiency of potassium, it's hypokalemia. Na stands for sodium. So deficiency of sodium is hyponatremia. Then about the body fluid compartments, you have two fluid compartments: extracellular fluid, intracellular fluid. So the extracellular fluid, 14 liters. Okay, this is the amount of fluid which is present in our body. 14 liters in the extracellular fluid and 28 liters in the intracellular fluid. So totally it makes up 42 liters. Or else, if an adult, it's around 70% of the body is made up with water. Okay, so that amounts to 42 liters. What is the composition of ECF and ICF? So ECF means extracellular fluid, mainly contains sodium, chloride, and bicarbonate. Okay, ICF is intracellular fluid, mainly contains potassium, magnesium, and phosphate. Okay, so these are the major components you find in ECF and ICF. What is the effect of low intake or less intake of water is dehydration. Okay, so when a person is not is taking sufficient amount of water, or if there's drastic loss of water, like in case of diarrhea or vomiting, that will go in for dehydration. Okay, so when there is less amount of water in the body, it leads to dehydration. Similarly, when there's too much intake of water, it's known as water intoxication. Too much of water. EUHYDRATION. That's euhydration is normal intake of water. What helps in transport of iron in the body? Mainly transferrin. Okay, transferrin is the protein which helps in the transport of iron, whereas the storage form of iron is the form of ferritin. Okay, that's the storage form of iron is ferritin. Transport form of iron mainly is transferrin. What enhances non-heme iron absorption? Mainly it is vitamin C. There are two types of iron, heme and non-heme. Heme is better absorbed, mostly found in animal products. Non-heme is mainly from plant products. So non-heme iron, it is better absorbed with the help of vitamin C. Okay, so that will enhance non-heme iron absorption. What does iron deficiency lead to? Now, iron deficiency will lead to iron deficiency anemia. Okay, it's also known as microcytic anemia. Microcytic means the size of the RBC is very small. That's why we call it microcytic anemia. And this is a very common type of anemia seen in iron deficiency. What is the condition caused due? Sorry, it's not due. It's due to overload of iron. It is mainly siderosis. Okay, high iron intake will lead to a condition called siderosis and hemochromatosis, where it is an inborn error where excess iron is being absorbed from the body. Okay, that condition is called hemochromatosis. Other is due to very high iron intake. Okay, sometimes people cook in iron vessels and everything, they use iron. Sometimes there is a chance for increased level of iron intake, which can lead to siderosis. What is the characteristic feature of IDA, that is iron deficiency anemia? It is this is the main sign you see, clinical sign you see in iron deficiency anemia is spoon shaped nails, which is called koilonychia. Okay, so it's known as koilonychia, spoon shaped nail. Name the national program for preventing iron deficiency anemia. It is NNAPP, that is National Nutritional Anemia Prophylaxis Program. This is from the government of India. Okay, so they have started this program way back in 1970 itself. They've started, but it was renamed later on. Due course, it was renamed and they have revamped the program. It's known as National Nutritional Anemia Prophylaxis Program. Then which amino acid is required along with iodine for synthesis of thyroid hormone? It is tyrosine. Okay, so this amino acid is essential for the formation of thyroid hormone. What are goitrogens? Okay, so these are substances which induce goiter formation. Okay, so anything which any food, even food items, they usually say that cruciferous vegetables, all these can induce goiter formation. So they're known as goitrogen. Anything which can induce goiter is known as goitrogen. What are IDDs? IDDs are iodine deficiency disorders. Okay. What is the national program for IDD prevention? That is iodine deficiency disorder prevention is NIDDCP. Again, this is a program from the government. National Iodine Disorders Control Program. National Iodine Deficiencies. These deficiencies there. National Iodine Deficiency Disorders Control Program. The two Ds are deficiency and disorders control program. How does copper act as an antioxidant? Mainly with the help of the enzyme superoxide dismutase. This is a copper containing enzyme which antioxidant means it prevents oxidation. Okay, so anything which acts as an antioxidant can prevent the chances of developing any chronic disease. Okay, it prevents free radical oxidation. Okay, it's a free radical scavenger. Okay, so here copper containing enzyme is superoxide dismutase. What is the effect of copper toxicity? Okay, it leads, that is excess of copper is what is copper toxicity. It leads to a condition called Wilson's disease, where there is excess copper accumulation in vital organs. Okay, it's caused due to a mutation in this particular gene, which is ATP7B gene. there is a mutation occurring in this gene, which is responsible for excess copper being accumulated in the vital organs like heart, eye. All these organs get affected, and that is known as Wilson's disease. What is fluorosis? Okay, that is fluoride toxicity, excess intake of fluoride. It leads to dental and skeletal fluorosis. So when water has more than 2 to 3 parts per million of fluorine, it leads to fluorosis. Okay, the water content ideally it should be less than 1 part per million, but when it exceeds more than 2 to 3 part per million of fluorine, it leads to a condition called fluorosis, which in turn causes dental and skeletal fluorosis. Which mineral deficiency causes hypogeusia and hyposmia? Hypogeusia means loss of taste. Even recently in COVID, we found that many people had loss of taste, loss of smell. Okay, loss of taste is hypogeusia, loss of smell is hyposmia. And this is caused due to zinc deficiency. So that is one reason why they were giving zinc supplements for COVID patients. Okay, so it's caused due to zinc deficiency. Which mineral helps in improving insulin sensitivity is chromium. Okay, so insulin is required for the uptake of glucose into the cell. Okay, so what happens here, sometimes there is insulin resistance where glucose is not able to enter the cell. So chromium is one mineral which helps to improve this insulin sensitivity, whereby glucose can easily enter into the cell. How does selenium have antioxidant effect? Okay, selenium is also considered to be an antioxidant. It acts as a cofactor for the enzyme glutathione peroxidase. Okay, this is the enzyme glutathione peroxidase, which contains selenium. What is the major function of vitamin A? It is Wald cycle, vision, mainly helps in vision. And there's a cycle called Wald cycle, which where vitamin A plays a very important role in the formation of rhodopsin. Okay, which form of vitamin A has antioxidant effect? It is beta carotene. What are the effects of vitamin A deficiency? It is night. These are the various forms of vitamin A deficiency with regard to vision: night blindness, white spot, xerophthalmia, keratomalacia, and follicular hyperkeratosis with regard to skin. All the other remaining are with regard to the eye. Okay, night blindness, white spot, you see a triangular spot in the conjunctiva. Xerophthalmia is dryness of the conjunctiva as well as the cornea. Both are known as xerophthalmia. It's individually known as conjunctival cirrhosis and corneal cirrhosis. Both together is known as xerophthalmia, where there is dryness of the conjunctiva and cornea. Keratomalacia is the final stage where there is softening of the cornea. It leads to total blindness. Okay, so that is again an effect of vitamin A deficiency. Follicular hyperkeratosis is like toad skin. You find dry skin. That is again caused due to deficiency of vitamin A. Then what is the National Program for Prevention of Vitamin A Deficiency? National Program Against Nutritional Blindness or Vitamin A Prophylaxis Program. This is again from the government. So this is various measures they have taken, like giving supplements. Supplements are given, fortification of foods with vitamin A, and also high dose vitamin A is also given depending on what is the deficiency level in children or in women. Okay, accordingly they will treat. So all this comes under the national program. Which is the active form of vitamin D is 1,25 dihydroxycholecalciferol. This is the active form of vitamin D. Is also known as cholecalciferol. Okay, so you also, apart from cholecalciferol is the active form, is also known as vitamin D3. There is something called vitamin D2 also. Okay, D2 is ergocalciferol. Okay, ergocalciferol is vitamin D2. D3 is cholecalciferol or 1,25 dihydroxycholecalciferol. What are the effects of vitamin D deficiency? Mainly causes rickets in children and osteomalacia in adults. What is the major function of vitamin K? It is mainly helps in blood clotting. Okay, and what is the synthetic form of vitamin K used in supplements is menadione. There are different forms of vitamin K. Menadione is vitamin K3. K1 is phylloquinone. We call it as phylloquinone, vitamin K1. Okay, and vitamin K2 is menaquinone. Okay, so this is menadione, which is mainly used in supplements. Vitamin K supplements mainly you make use of menadione, which is vitamin K3. What are the effects of thiamine deficiency? It leads to a condition called beriberi. Okay, you have a dry beriberi, wet beriberi. Okay, so it's a condition, neurological condition where the nerves are all affected. It's caused due to thiamine deficiency. What are the clinical features of riboflavin? Is vitamin B2. Thiamine is B1. Riboflavin is B2, vitamin B2. And the deficiency leads to angular stomatitis, chelosis, and glossitis. Okay, angular stomatitis is you have cracks in the corners of the mouth. Chelosis in the center, you have cracks in the center. Glossitis is inflammation of the tongue. Okay, so that is what is glossitis. Then what is niacin equivalent? That is 60 milligram of tryptophan is equivalent to 1 niacin equivalent, or 1 milligram of niacin. Okay, so you should remember the 60 milligram. So 60 milligram of tryptophan can be converted to 1 milligram of niacin. What is the effect of niacin deficiency? It mainly leads to a condition called pellagra. What are the effects of folic acid deficiency? It leads to neural tube defects, which include spina bifida, anencephaly. Spina bifida means split spine. In babies, you find that anencephaly is without brain. Sometimes the baby is born, but usually it leads to stillbirth. Okay, but these are the condition which is mainly caused due to folic acid deficiency in pregnant women. Okay, neural tube defects in children in the newborn is spina bifida and anencephaly. Other condition is megaloblastic anemia. What are the effects of B12 deficiency? Again, I told you this: megaloblastic anemia and pernicious anemia. How does egg white injury cause biotin deficiency? Now, avidin is a protein which is present in egg white. This prevents biotin absorption from the intestine. Okay, and this is only found in raw egg white. Avidin is a protein found in raw egg white, which can prevent biotin absorption. Okay, so that's what leads to egg white injury. Which vitamin helps in carnitine synthesis? Vitamin C. Now, carnitine helps to transport fatty acid into mitochondria to be oxidized to release energy by cell. That is mainly helps in transporting fatty acid. And that is called carnitine helps in transporting fatty acid. And vitamin C plays an important role in that. What are the effects of vitamin C deficiency? It leads to scurvy, condition called scurvy, where there will be bleeding gums. Okay, all this is common, and that's called gingivitis. The condition bleeding gums with inflammation is called gingivitis. Now, which is the richest source of vitamin C? Okay, amla, that is Indian gooseberry or the nellikai, we say Indian gooseberry. It contains 252 milligram per 100 gram. That is the richest source of vitamin C. Name any 4 dietary antioxidants, that is vitamin C, beta carotene, selenium, and vitamin E. These are all dietary antioxidants. Name the phytochemical present in tomato. It is lycopene. Okay, this is also known as flavonols or phytochemicals. Okay, they are known as it's called pigment, but is present in the tomato is lycopene. Name the flavonoids present in green tea. Okay, it is called catechins and gallic acid. Green tea, you know, it is very good for health, helps to reduce weight, and all the other benefits are also there, mainly due to the presence of flavonoids. Okay, and the flavonoid present in green tea is catechin and gallic acid. What is omega 9 fatty acid? Is mufa. Okay, I already told you about oleic acid, the same thing, mufa. Which vitamin is only found in animal source? Is vitamin B12. That's why they say mostly vegetarians can go in for vitamin B12 deficiency, because mostly the sources are only from animal sources for vitamin B12. Okay, so this is about human nutrition. So are you able to follow, or am I too fast? Is it okay for all of you? Are you able to follow?
Yes, ma'am. Yes, ma'am.
Are you able to follow? Okay, yeah, thank you. Okay, now we move on to clinical nutrition, dietetics, and sports nutrition. Okay, so first is, what are the characteristics of metabolic syndrome? You'd have heard of this condition called metabolic syndrome. So this is characterized by high blood pressure, low high density lipoprotein, okay, and high triglyceride, obesity, and insulin resistance. So these are the features you find in metabolic syndrome. Okay, blood pressure, that is hypertension. The HDL is generally considered as good cholesterol, that is low here. Then high triglyceride, obesity, and insulin resistance. Which is considered as good and bad cholesterol? HDL is good, LDL is bad. Which bacterium cause peptic ulcer? Okay, which can cause peptic ulcer is Helicobacter pylori. So this is the bacterium which can cause peptic ulcer. What group of drugs can cause peptic ulcer? It is NSAID. This is non-steroid anti-inflammatory drugs. Okay, this group of drugs can cause peptic ulcer. Non-steroid anti-inflammatory drugs like aspirin. Okay, all this come under this category. So that can cause peptic ulcer. List few symptoms of peptic ulcer, like epigastric pain. Epigastric pain is pain in the upper part of the stomach. Flatulence is gas production. Okay, that is flatulence. Dyspepsia is indigestion. Okay, there's indigestion. Hemorrhage is bleeding. Okay, sometimes bleeding is the first sign of peptic ulcer in certain cases. Okay, so these are all some of the symptoms you find linked to peptic ulcer. What is responsible for celiac disease? Now, celiac disease is called gluten sensitive enteropathy. That is, there is sensitivity to gluten. Okay, so people having this celiac disease should not consume products which contain gluten. And gluten is mainly found in wheat products. Okay, so you find gluten in wheat products. Which fraction present in gluten is responsible for celiac disease? So gluten is made up of two things. One is gliadin and glutenin. Okay, so two fractions are there in gluten itself. One is gliadin and glutenin. So gliadin is the one which is causing the problem in celiac disease. Okay, so if a person having celiac disease consumes any food containing wheat, then it leads to diarrhea, vomiting, rashes, allergy, lot of symptoms you can see as soon as they consume food which contains gliadin or gluten. Okay. What are inflammatory bowel diseases? Okay, you have two things: Crohn's disease and ulcerative colitis. These two come under IBD. It's also known as IBD, inflammatory bowel disease. Crohn's disease is there is inflammation in any part of the digestive tract, in the gastrointestinal tract. It can happen anywhere. Ulcerative colitis means there's inflammation only in the terminal part of the colon. Okay, so in the rectal region or the terminal part of the large intestine, okay, that's the colon, or in the rectum you find the inflammation. Okay, that is what is ulcerative colitis. What is ORS? Is oral rehydration solution, mainly given for the treatment of diarrhea. Okay, when there is dehydration, they go in for ORS or oral rehydration solution. What is the normal BMI cutoff for Asian Indians? It is 18.5 to 22.9. Okay, this is the normal cutoff. So anything between 23 to 25 is considered as overweight. More than 25 is considered as obese. Okay, so according to the current cutoff, that is how it is. More than 25 itself is obese for Asian Indians. What is apple and pear-shaped obesity? That is, apple is also known as android. Okay, where you mind, I usually find this type of obesity in male people. You would say the belly fat. Okay, the belly fat is what we call as android obesity. Gynoid is what you typically see in women, where they try to put on weight in the lower half. Okay, the pear-shaped. Okay, so that is what we call below the hip. No? So that is what is gynoid or pear-shaped obesity. What is hyperplastic and hypertrophic obesity? Increase in fat cell number is hyperplastic. Hypertrophic is increase in fat cell size. Okay, so hyperplastic means increase in fat cell number, and hypertrophic means increase in fat cell size. What are the types of PEM? That is protein energy malnutrition. You have kwashiorkor, marasmus, and marasmic kwashiorkor. That is a combination of both kwashiorkor and marasmus. Kwashiorkor is mainly caused due to deficiency of protein. Marasmus is caused due to deficiency of mainly protein and energy, you can find here. Marasmus kwashiorkor is you find the clinical signs of both kwashiorkor and marasmus. The clinical symptoms you'll find in marasmic kwashiorkor will have both the symptoms of kwashiorkor and marasmus. Okay, what are the classic signs in cirrhosis? Cirrhosis is a liver disease. Okay, so in this liver disease, the classic signs are ascites, portal hypertension. Ascites means there's accumulation of fluid in the stomach. You can see the stomach will be protruding. Okay, it will be inflamed. Okay, you find this particular specific condition in this liver disease called cirrhosis. Okay, that is ascites. Portal hypertension is increase in hypertension in the liver, the portal vein. Okay, those are classic signs in cirrhosis. And what is ESLD is end stage liver disease. Okay, it's also known as hepatic encephalopathy. Okay, or hepatic coma. That is what is ESLD. How is jaundice diagnosed? Okay, so how jaundice again a liver disease. All of you may be familiar with that. And when serum bilirubin levels are more than 3 milligram per DL, it can actually diagnosed as jaundice. Normal levels are less than 1 milligram. It should be less than 1 milligram. But when it is jaundice, the bilirubin levels go beyond 3 milligram. And bilirubin are all the bile pigments. Serum bilirubin, biliverdin, these are all known as bile pigments. What is cholecystitis? Is inflammation of the gallbladder. That is what is cholecystitis. Then cholelithiasis is formation of gallstones. Okay, the stones which are formed in the gallbladder. That process or the known as cholelithiasis. What are the two types of gallstones? There are two types. One is cholesterol stones and pigment stones. What is renal calculi? That is renal calculi is the alternate name for kidney stone or nephrolithiasis. What are the types of renal calculi? That is renal stones. There are different types. Struvite stone, cystine stone, calcium oxalate stone, and uric acid stone. These are all different types of kidney stone. Okay, struvite, cystine, calcium oxalate, and uric acid stone. What are ash diets? Okay, they have different diets given for renal calculi. Acid ash diet is for alkaline stones, and alkali ash diet is given for acid stones. So if the stone is made up of uric acid or cystine, they'll give alkali ash diet. If the stone is made up of calcium oxalate or so, they give acid ash diet, depending on what the stone is. But ash diets are given for treatment of renal calculi. What are the classic signs of nephritis? Two classic signs, hematuria and proteinuria. Hematuria is loss of blood in the urine. Proteinuria is loss of protein in the urine. So this is the classic sign of nephritis, which is a kidney disease. And what is known as degenerative Bright's disease is nephritis. Alternate name for nephritis is degenerative Bright's disease. What are the classic symptoms of nephrosis? Again, it's a kidney disease. It can cause marked edema, that is accumulation of fluid in the legs. Okay, edema. And proteinuria is loss of protein in the urine. The protein lost is mainly albumin. So when there is more loss of protein in the urine, the blood protein levels will come down. That's why we call it as hypoalbuminemia, because in the blood the albumin level is low because everything is lost in the urine. Okay, so these are the two main symptoms you see in nephrosis. And what is the normal glomerular filtration rate is 125 ml per minute. Okay, the glomerular filtration rate by the nephron. Okay, 125 ml per minute. What is azotemia? That is increased level of urea, creatinine, and other nitrogenous compounds. That is what we call as azotemia, mostly found in renal failure. In patients of renal failure, you find this condition called azotemia. Too much of urea, creatinine, and other nitrogenous compounds are seen. And what is the ideal total cholesterol is to HDL ratio? This is mainly related to the heart. It has to be less than 4.5. That's a good ratio if it's less than 4.5. What is the normal blood cholesterol level? It should be less than 200 milligram per DL. Normal triglyceride level should be less than 150 milligram per DL. Which type of fat is considered beneficial for heart health? Mainly it is the monounsaturated fatty acid and the omega-3 fatty acids. So MUFA is oleic acid, omega-3 is linolenic acid. What is the underlying mechanism in CHD? So what is the main cause of CHD is atherosclerosis, where there is hardening of the coronary artery. Okay, so that is what you find in atherosclerosis. What is the optimum BP? That is normal level of BP, which is considered as optimum, is 120/80 mm Hg. What diet is recommended for hypertension? Mainly DASH diet. We call it as dietary approaches to stop hypertension. Okay, the DASH diet mostly contains fruits and vegetables, is recommended for patients with hypertension. What is the classic triad of diabetes? That is, a triad means triangle, which means the classic symptom of diabetes is polyuria, polydipsia, and polyphagia. Polyuria is increased urination, polydipsia is increased thirst, and polyphagia is increased hunger. Okay, so all these three symptoms are very common in diabetic patients. Which test helps to identify the control of blood sugar for the last 3 months? That is, it gives the average blood sugar control for the average for the last 3 months. It's called HbA1c test or glycosylated hemoglobin test. Okay, it's called HbA1c or glycosylated hemoglobin test. What is hypoglycemia? That is when the blood sugar levels go less than 70 milligram per dl. Okay, it is seen as an acute complication in diabetes. Go suddenly can go low, can go high. Increase means hyperglycemia, lower means hypoglycemia. What is the common complication seen in type 1 diabetes mellitus? Is diabetic ketoacidosis. It's a very common complication you see in type 1 diabetic patients. Give examples of ketone bodies in blood. It is 3 types: acetone, acetoacetic acid, and beta hydroxybutyric acid. These are the ketone bodies which are found in the blood. What are the microvascular complications of diabetes? Mainly you have retinopathy, nephropathy, and neuropathy are the microvascular complications. How are foods classified according to glycemic index? This is glycemic index. Actually, it helps to find out which foods can increase the blood sugar level soon after it's ingested. So any food having less than 55 has got low glycemic index. 56 to 69 is medium glycemic index, and more than 70 is high GI foods. Generally, foods which have high glycemic index are avoided for diabetic patients. Which enzyme is affected in phenylketonuria, an inborn disorder, inborn error of metabolism? So it is phenylalanine hydroxylase. Okay, so it prevents conversion of phenylalanine to tyrosine. Which enzyme is responsible for galactosemia? Is again an inborn error of metabolism. Galactose 1 phosphate uridyl transferase. It prevents conversion of galactose to glucose. What is cachexia? Cachexia is a condition where there is extreme weight loss and muscle wastage, commonly seen in cancer patients. Okay, there is extreme loss of weight and muscle wastage. That's called cachexia. Which category of patients are prone to opportunistic infections? Okay, that is, they have a very weak immune system, so they are more prone to other infections. Mostly it is seen in HIV patients. Okay. Then what is the classical sign seen in typhoid patients? There's a sign called Peyer's patches. There is inflammation in the lymphatic system. Okay, you have flat patches you find on the lymphatic system, which is a sign of seat of infection in typhoid patients. That's known as Peyer's patches. What is hyperemesis gravidarum? That is prolonged persistent vomiting, which is seen in pregnant women. It's a complication of, you can see as a complication of pregnancy also or a common problem seen in pregnancy. Okay, there is severe vomiting and prolonged and persistent vomiting. What is the rise in BMR? That is the basal metabolic rate for every degree Fahrenheit or Celsius rise in body temperature. That is when you have fever, how much does the BMR increase? So if it is in Fahrenheit, it is 7%. And if it is in Celsius, it is 13%. So for every degree rise in body temperature, the BMR increases by 7% for every degree Fahrenheit rise. For every degree Celsius rise, it increases by 13%. Which drug is used in the treatment of tuberculosis is antagonistic to vitamin B6. That is, it prevents absorption of vitamin B6. That drug is called isoniazid. It's commonly given to tuberculosis patients, and people who are on this drug, there is reduced absorption of B6, which is pyridoxine. What is the causative organism for TB? It is Mycobacterium tuberculosis. Okay. And what is PIH? That is pregnancy induced hypertension. Okay, that is what is PIH, and it's characterized by increased edema, high blood pressure, and albuminuria. Okay, what is the name of the iron containing protein present in breast milk? It is called lactoferrin. It inhibits growth of E. coli and staphylococcal organism. Okay, it's a protein, iron containing protein in breast milk is lactoferrin. What is the lactose protein ratio of human milk and cow's milk? 7:1 for human milk, 4:1 for cow's milk. What is pica? Pica is consumption of non-food items like chalk, clay, okay, all these things commonly found during pregnancy and sometimes also seen in preschoolers. What is the ideal weight gain in pregnancy? Is 11 to 13 kg. What are the types of eating disorders? You have three types mainly: anorexia nervosa, bulimia nervosa, and binge eating. And what is FODMAP? FODMAP is fermentable oligosaccharide, disaccharide, monosaccharide, and polyols. Okay, so this group of these foods which fall under this FODMAP generally are indigestible. Okay, sometimes can cause digestive problems. So generally they say people with irritable bowel syndrome who have got problems in digestion should consume less of this type of foods, mainly found in pulses where there is flatulence, no gas production. All these foods can sometimes cause. So known as FODMAP, FODMAP. What is female athlete triad? Triad is eating disorders, menstrual disturbances, and osteoporosis. This is commonly seen in athletes, female athletes. That is eating disorders, what I told you earlier, bulimia nervosa, okay, all that, anorexia nervosa, all that will come. Menstrual problems like amenorrhea and osteoporosis. Okay, that is where there's problem with which can lead to fracture. Calcium deficiency is common in athletes. Which energy system is used as immediate source of energy, especially for high intensity sport? Mainly it's the phosphagen system. That is for immediate, anything which is required for immediate energy is phosphagen system, and uses creatine phosphate to produce ATP. ATP is the energy currency of the body is ATP, that is adenosine triphosphate. Okay, so this uses this particular system uses creatine phosphate to produce energy. What is the energy currency of the body is ATP. What is DOMS in sports? That is delayed onset muscle soreness. Okay, so delayed onset muscle soreness is the muscle becomes very weak due to excessive exercise. Okay, that is not is known as DOMS. What are ergogenic aids? Ergogenic aids are those which can enhance performance Okay, so people take, there are different types, nutritional, pharmacological, psychological, different category of ergogenic aids are there, but generally ergogenic aids helps to enhance sports performance. What type of muscle fibers are used in sports? Mainly you have two types, slow twitch and fast twitch fibers. So depending on the type of exercise, either slow twitch or fast twitch will be used. What is max VO2 is maximal oxygen uptake by exercising muscle. Okay, so that's what is max VO2. It's a very common definition they ask in sports nutrition. That is maximal oxygen uptake by the exercising muscle. Next one, what is NEAT? Is non-exercise activity thermogenesis. That means any activity, not like sports activity, anything like even walking, just sitting or gardening, any activity you do regularly, routine activity, but not like a strenuous or any kind of structured activity, anything like a walk, just taking up the stairs, all this comes under non-exercise activity thermogenesis. That is how much of energy is utilized even for these type of activities. It helps to assess that. That's called non-exercise activity thermogenesis. What is the strategy used by endurance athletes to build their glycogen level? It's called glycogen loading. Okay, so they will load the person with carbohydrate. That's called glycogen loading, just 7 to 8 days before the competition. It's mainly used for endurance athletes, means they have to involve in athletic event for more than say 2 days, like marathon, something like marathon. So they go in for glycogen loading. What is the role of BCA in sports? That is mainly, that is branch chain amino acids. We saw that earlier. Isoleucine, lysine, and valine. Isoleucine, leucine, and valine. So these three mainly help in muscle recovery and growth. They are known as branch chain amino acids. What is the role of creatine monohydrate in athletes? It increases muscle mass, improves performance, and aids recovery. Okay, that is the role of creatine monohydrate in athletes. Also comes under ergogenic aid. What is muscle hypertrophy? Is increase in muscle mass, increase in size and strength. That is what we call as muscle hypertrophy. And what are the components of sports drinks? Mainly carbohydrate. It contains carbohydrate and electrolyte, mainly in the form of glucose. That is what is usually given. So we'll just quickly move on to the food science. Okay, so this is like MCQ is what I've given. Okay, so this one, which of the following microorganism is eliminated in canned foods? Okay, so it is Clostridium botulinum. Okay, so it's also one particular microorganism which can also cause poisoning. Okay, so this is the microorganism which is eliminated in canned food is Clostridium botulinum. In HTST, that is high temperature short time method of pasteurization, milk is exposed to a temperature of 161 degree Fahrenheit or 72 degrees centigrade. Okay, Celsius means C means 72. Fahrenheit means 161. Okay. Lactic acid and acetic acid are used for what? It's used for preservation of pickles. Then combination of several preservation techniques together is called as hurdle technology. Not one technique, but they may be using 3 or 4 techniques for preservation. Then it's called hurdle technology. The process of breaking down of complex matter into simpler ones with acid, bacteria, and enzyme is known as fermentation. Okay, so for fermentation is with the help of bacteria, enzymes, as well as acid. Okay, so that is what we call as fermentation. Which chemical is used for inhibiting fungal growth of non-enzymatic browning in fruit juices? There is enzymatic and non-enzymatic browning is there. This they mainly ask about non-enzymatic browning. So which chemical is used for inhibiting fungal growth is sulfur dioxide. Okay, so you have something called enzymatic browning, which is also known as Maillard reaction. Okay, so this is non-enzymatic browning. What is the preservative used in many processed meats? It is sodium nitrite. Nitrate is also used. Sodium nitrite as well as nitrate is also used as a preservative for processed meats. Which chemical is used as anti-mold agent in bread? It is calcium propionate. It prevents that fungal or mold growth. Canning of food is also known as appertization. Okay, it's the canning, the procedure. Canning of food is also known as appertization. Then preservation of food using UV ultraviolet rays is called irradiation. Okay, that is all methods of food preservation. The most common sugar used in soft drink is HCFS, that is high fructose corn syrup. Okay, that's the most common sugar which is used in soft drink. Percentage of water in carbonated soft drink is 92%. So any carbonated drink will have 92% water. The maximum concentration of alcohol in beer is 3 to 6%. Which of the following is a fermented beverage? So among this, it is lassi. There should be at least dash percentage of pulp in fruit drink. Okay, so any fruit drink should have at least 20% of pulp. The enzyme used in fruit juice industry, mainly for fruit juice, the enzyme used is pectin. What is the principal carbohydrate present in milk of all mammals? It is lactose. Okay, the principal protein in milk is casein. Whey is the byproduct in the manufacture of mainly cheese. Okay. The temperature used in ultra high temperature treatment is 130 to 140 degrees centigrade. This is for UHT. Sterilization is usually done at 121 degrees centigrade. That's the temperature for sterilization. Rancidity is actually referring to spoilage of fats. That's what we call as rancid or rancidity. Malic acid is organic acid present in apple. The moisture content of stable food vary from more than 15%. The moisture content of stable food is more than 15%. And dash is known as flash pasteurization, that is UHT, ultra high temperature. Okay, this is known as flash pasteurization. And dash is used as a stabilizer in ice cream. It is mainly gelatin. It is used as a stabilizer in ice cream. Then in canning of fruits, concentration of sugar varies from 20 to 40%. Okay, when you can fruits, the sugar concentration varies from 20 to 40%. Blanching is the heat treatment in foods for a very short time, mainly to destroy enzymes. Okay, blanching is a method of cooking, no, where you put that whatever food item in boiling water. You just place it in water which is boiling for some time, and then immediately you show it under cold water, so it prevents further cooking. Okay, so that no one advantage is it helps to prevent remove the surface dirt. Second is it also deactivates enzymes. That's also an advantage of blanching. Mixing of two immiscible liquid is emulsion. That is known as emulsion. Autolysis in food can be prevented or destroyed by destruction of enzymes. Okay, so you can prevent autolysis by destruction of enzymes. Lyophilization is also known as freeze drying. This is again a method used for preservation. So lyophilization is also known as freeze drying. Bracing is it's a cooking method. It's a combination of roasting and stewing. Okay, it's a cooking method. Bracing, it's a combination of roasting and stewing. Ragi is also known as finger millet. This is for the millets. There are different type of millets, so you can know the different names of millets. Ragi is known as finger millet. Which vitamin content increases maximum following germination? It is mainly vitamin C. Okay, around 7 to 20 milligram it increases. Okay, so vitamin C. Then pulses are deficient in which amino acid? Mainly it is deficient in methionine. Garden cress seeds are rich in iron. Okay, mainly garden cress seeds are mainly rich in iron. Which enzyme is used in tenderizing meat? Mainly papain. This is from papaya. Okay, so this papain is generally used in tenderizing meat. Anthocyanin, these are pigment which is present in red grape. Okay, mostly you find this in red grape, anthocyanin. Which enzyme is responsible for enzymatic browning is polyphenol oxidase. Okay, polyphenol oxidase is responsible for enzymatic browning. Which of the following can prevent enzymatic browning? Vitamin C and sulfur dioxide. These two can prevent enzymatic browning. What is non-enzymatic browning is Maillard reaction. Okay, so this you find like in milkmaid and all. If you keep it for some time, you after a longer period, it changes color, it becomes more brown in color. So that is called Maillard reaction. The reaction is between reducing sugar and an amino acid. Okay, so that is what happens in Maillard reaction. Example of hydrogenated fat is margarine. Okay, so I told you about hydrogenated fat or partially hydrogenated fat. All this is margarine. Which compound is formed when fat is heated beyond its smoking point is acrolein. That is, reheating fats again and again or oils again and again can lead to the development of a product called acrolein, which can cause cancer. Drinking tea immediately after meals can reduce the absorption of iron. What is responsible for fermenting beer? It is Saccharomyces cerevisiae. Okay. Then the chemical used for curing meat is sodium nitrate, or nitrite also can be used. Chelating agents are also known as sequestrants. Okay, they are known as sequestrants. That is, they help in the stabilization of the food. They prevent oxidation, also helps in stabilization of food by chelating with metals like nickel, all this. Okay, so that is what we call as sequestrants. Yeah, that is the last one here. So this is something which I prepared for dietetics. Like questions like choice one, like MCQ. So which is the right one? Like milk is avoided in this diet. The option is clear fluid, full fluid, soft diet. So diet you can, I think somebody else will be doing it later. But milk is avoided in a clear fluid diet. This is something which you should know. Repeatedly they ask in many places. Milk is avoided in which diet? It is clear fluid diet. Identify the causative factor in celiac sprue that I told you, gluten. Among the four, it is gluten is responsible. Identify the classic symptoms seen in cirrhosis. This is ascites. I told you about ascites and portal hypertension. So ascites is a classic symptom of cirrhosis, which is a liver disease. Name the diet recommended for treating hypertension is DASH diet. I just told you about the DASH diet, dietary approaches to stop hypertension. That is recommended for treating hypertension. The bacteria responsible for causing peptic ulcer here is Helicobacter pylori. Okay, so this is like you have certain assertive and reasoning questions in your net exam. So I just prepared a few here. Okay, so here it says therapeutic diets and foods. This you can leave off the first column. The second column one gives you like, it's fill in the, like, match the following: clear fluid diet. All the A column, clear fluid, soft diet, full fluid, high fiber diet. Column 2 has all the answers here: whole grain, strained fruit juice, eggnog, and mashed rice. So which is right? The answer key is anyway given there. Clear fluid, as I told you, it is in, you can see strained fruit juice. Okay, soft diet, you can find here in mashed rice. Okay, so the answer key is A2, B4. Okay, so full fluid diet, you see in 3, eggnog. Okay, and high fiber diet is whole grain. Okay, so based on this, you can find the answer key is also given. So next is the conditions, therapeutic conditions, and their symptoms are given. Peptic ulcer, you can match it with epigastric pain. Typhoid is Peyer's patches. Tuberculosis is persistent cough. IBS is irritable bowel syndrome, which is linked with diarrhea. Then the next one, again, the disease conditions and their symptoms. Cirrhosis, you can say it's linked to the ascites. Cholelithiasis is gallstone. Nephritis is edema. Okay, and nephritis, sorry, is hematuria. Nephrosis is edema. Marked edema is nephrosis. Hematuria is a classic sign of nephritis, where there is loss of blood in the urine. The fourth one, with diabetes. Diabetes is linked with retinopathy as a complication. CHT, smoking, is a risk factor. Hypertension can lead to stroke. Thyroid disorders, goitrogens. Increased intake of goiter containing foods, goitrogen containing foods can lead to goiter formation. The last one here is the conditions are given here. CHD is mainly linked here with TLC, is therapeutic lifestyle changes diet. They give a diet for recommending low fat diet. Okay, it's called TLC. Hypertension is DASH diet. Diabetes is low glycemic index foods. Those are the foods which are recommended. Thyroid disorders is linked with iodized salt. Okay, so these are the assertion and reasoning questions. Like you can find both A are correct. You can find in your paper, that UGC-NET coaching paper. So assertion and reason, just few are here. A says tube feeding may be required for cancer patients, and reason is cancer patients meet their nutritional requirements with tube feeding. Okay, so the assertion question is tube feeding is required for cancer patient. The reason they are giving is cancer patient meet their nutritional requirements with tube feeding. Okay, the answer is both A and R are true, but R is not the correct explanation of A. That's the right answer. Okay, which means both the statements are true, but the reason given is not the right explanation of A, because cancer patient meet their nutritional requirements with tube feed, not only with tube feeding. Maybe they have to be also beyond parenteral feeding, which is through vein, intravenous. Okay, so you cannot say that is the right answer. Okay, so right reasoning. A and B are true statements, but the explanation is not right. Similarly, the next one, bland diet is suggested in peptic ulcer. The reason is bland diet is mechanically, thermally, and chemically non-irritating. Okay, so the answer is both A and R are true, and R is the right explanation of A. So everything is right here. Bland diet is suggested for peptic ulcer, and it is mechanically, thermally, and chemically non-irritating. Third one says excessive alcohol consumption leads to cirrhosis. Reason, alcohol is detrimental to health. Okay. So answer is both A and R are true, but R is not the right explanation of A. Okay, so excessive alcohol is the cause for cirrhosis, but the reason given is not the right linked with alcohol is detrimental to health is right, but that's not the right answer for the assertive statement given. Okay, the next one is junk food increases risk of obesity. That's the assertion. Reason is junk foods are high in calories, sugar, and fat. Okay, so both A and R are true, and R is the right explanation of A. And the last one says high fiber foods are recommended for diabetes patients. All cereals and pulses are rich in dietary fiber. So A is true, but R is false. Okay, so R is false. You cannot say that all cereals are rich in fiber. Not everything. Okay, so only whole grain cereals are rich in fiber. So that's a wrong statement. Okay. So this is just definitions. What is therapeutic nutrition? List true foods for tube feeding, post-surgery, paralysis of muscles, bland diet. I just told you mechanically, chemically, and thermally non-irritating. Different types of renal calculi. I already told you this. The different type of stones. Android, gynoid, obesity. Also the same question. Okay. So I think with that we come to the end of this session. I hope you have understood at least something. Was it helpful? Students, hope you've at least able to understand certain things. Yes, yes. Thank you so much.
Students, if you have any doubts, you can ask here. It's a phenomenal presentation, ma'am, you delivered to our UGC aspirant students.
Thank you. Yeah, definitely. I'll share my
Yes,
PPT. I'll share the
yes, ma'am.
questions with all of you. I'll send it to ma'am's mail, and you can get it from.
Yes, ma'am. And each and every units with all the specific terms and questions you have cleared, because these terms very often they are asking in UGC-NET
Yeah.
exam, and
Yes.
students definitely will enhance the knowledge on this, ma'am.
Thank you. Thank you so much. I hope you all
Yes, ma'am.
benefit. That's what I want. So I tried my best to put in from the earlier papers all the questions and what is frequently asked in various other exams also. Okay, so I hope you'll be
Mm-hmm.
benefited with just go through these questions and also the earlier question papers you have where the solved papers are there. So just go through them so you'll be able to understand better and you'll be able to clear your net. Not just clearing, you'll also get JRF also. You can continue your higher studies. Okay, so that also is possible. So wish you all of you all the very best. Okay, prepare well. Don't get scared of net exam. It's nothing to get scared. Okay, just prepare your best. You do your best and God will do the rest. That's how it is. Okay, so thank you so much, Dr.
Yes,
Meena, for inviting
yes,
me,
ma'am.
and it has been a pleasure to be to deliver this lecture to your students. Thank you so much.
Yes. Thanks a lot, ma'am. Each
Thank,
day we are providing students with UGC mock test previous question paper through Google Form, and students, all the candidates are doing that, and
mm,
the study materials also we are forwarding to them
okay.
continuously all the days, ma'am.
Mhm. Very good.
Various universities have been participated here, especially from Guntur University from Andhra and Udaipur, and
Mhm.
in UP also they have joined, and so many other colleges have joined here, ma'am.
Okay, great, great. I
Yes, ma'am.
hope you'll be definitely benefited by this course. I mean, this
Yes.
sessions, various sessions, all very good resource persons. Ma'am has tried to contact and get, and I'm sure you'll be benefited. Okay, so wish you all of you. I'm wishing you all of you the very best. Do well. Okay, hope you'll clear your UGC net very soon. Okay,
Hope so,
okay.
ma'am. Thanks.
So
Thanks
much,
a
ma'am.
lot, ma'am.
Thank you.
Dear participants, now the feedback link will be given in the chat box. Any doubts also you can share us. We will also provide the materials, whatever ma'am is sending. So daily practice well. That's more important. If you are practicing, definitely this exam will be cleared in this future exam itself. Thank you all.
Aisha, are you providing this feedback link?
Ma'am, link has been posted, ma'am.
Okay, thank you all. Thank you.